I am the president of the HU Peers, Howard University Peers, Educating, Empowering, and Reaching Students. I came up with the idea for the event because we have been doing, as we typically do, a lot of outreach. We're always giving out condoms and things on campus. We have lots of tables because we're a general health organization, so we have tables around all sorts of issues, breast cancer, heart disease, sexual health, blah, blah, blah. And we're always giving out condoms. We were trying on, during homecoming, we make lots and lots of kits, and we were trying to give them out. And people were really rude, to say the least. They weren't very receptive, and we didn't really understand that because I also am in the health center a lot, and we're seeing that a lot of people, the STIs are a reality on our campus, I'll put it that way. And so to have so many people be reluctant, but at the same time, it's clearly an issue, we really wanted to have an open conversation about why this issue is arising and why it's continuing and why people are reluctant to get our services.
Fortunately, I made the mistake, and I have been HIV positive for 4 years. So, that's another reason why I wanted to come here to share my story with you guys and, let you know that HIV does not have a face. And I'm sure some of you have been thinking, this guy doesn't look like he has HIV. Well, HIV does not have a face, and that's why it's important for you guys to get tested regularly. Because if you don't get tested, silence is what kills you, not the virus. Okay?
This is not only a conversation that we need to have out in the open in this type of way, but I want to make you guys comfortable enough to be having these conversations with the people that you're having sex with. That's where it needs to happen. So come here, get your information, get your condoms, and continue this conversation once you get home with the people that you are intimate with.
If you are a young person in the District of Columbia, you can get tested for free now. Okay? The phone number is 202-388-4770. You can make an appointment or you can walk in. But I really want to put that out there because in this time of shortages, we have to come together. You can get STD screening there as well.
I really wanted there to be an exciting sort of piece, so that is kind of why we wanted the spoken word, so that people weren't just listening to people babble all the time.
Let's say that we don't understand what either of us is speaking. Right now, I just want to be illiterate. To take too many antiretrovirals. He got it, she got it. It's funny how we whisper about this, talk loud about our habits. Why are these 3 letters knocking at my door? Giggling like children, becoming thieves in a now quiet night.
Tonight we'll present to you what could potentially happen when people have unprotected sex. Consider this scenario. 2 people are about to have sex. At first thought, it doesn't seem like a big deal. They're both attracted to each other, so the idea of them having sex isn't too far-fetched. At this point, they only are considering one potential consequence: self-gratification.
You're my bad habit, baby, you're mine. You're taking my soul down to the level. Can't escape the way you got me locked up, baby. I gotta break from you, break from you, break from you.
I was really happy that so many people were talking and asking questions and really participating. There was a lot of brave souls in the audience, and people were really cool about asking questions and really talking and really getting the conversation flowing and keeping it flowing. So that was really, really nice.
And I really loved the panelists. They were talking to us and being real to us about sex and stuff. And a lot of time people were like iffy. My parents, usually my mom's really iffy about talking about it, and she would like beat around the bush. But it's kind of like they kind of like told us straight up what we really need to know.
Pretty much today was really, really important because, let's face it, we're in college, we're all adults, and we have sex. So, and diseases are no joke, so we really need to learn what to do preventing them, and if somebody, just to say somebody has it, what to do if they do have it, because, it's the stigmas and the fears and just pretending like this stuff doesn't exist and doesn't happen is how all problems start, and just how a whole bunch of issues that could be avoided if we just stop pretending like these don't happen.
The reason why events like this is important to have, not only here in the district but nationally, is because of the high rates of HIV/AIDS and STDs as well across the country. We have 1.2 million people infected with HIV in this nation, and it's growing, especially with the young people. So we think that events like this on campuses would help with getting people tested more. I think that the students got a lot from it. I know that the students got a lot from it, so I hope that they can go out and actually educate their peers.
People were open, and so I thought it was a really good event, especially for our first real big one. So I'm really happy about it.